Hello everyone. So another video of ELISA series, and in this we will be talking what are the problems we encounter when we are performing the ELISA and how we can resolve these problems. So what factors that will affect our test results? They are basically categorized into three: pre-analytical, analytical, and the post-analytical. So in pre-analytical, either the sample is hemolyzed or lipemic, or repeated freezing and thawing happen. Contaminated sample or reagents are there, or there is improperly stored, expired, or deteriorated reagents we are using. Then the result can be affected. In the analytic, there is either error with the pipetting, then improper incubation time and temperature, improper washing procedure, or some other specimen is carryover happened, or equipment malfunction, glove powder aerosol, calculation errors. In the post analytical, there is error of transcription. What are the interfering factors? Plate assay, the shape and the quality of the well and material of the plate, potential pre-activation, even or uneven coating. Then buffer, it will include your pH contamination. Then capture and detection of the antibody. So it will be having the incubation time, temperature, specificity, titer, affinity, then blocking buffer, cross-reactivity, concentration, and contamination. Target antigen, then this include your epitope, conformation, stability, enzyme conjugate, type, concentration, function, cross-reactivity. Washes, contamination, frequency, volume, duration, and composition. Then in substrate, either the quality or the manufacture. Then detection instrument, the instrument dependent factors may be there. Then the transcription means the reading error or appropriately identifying or not identifying the test. And this is the ideal ELISA plate layout. So we have a blank control, then external control, negative, and the positive control. Now we will tell about the in interpretation of the result. So validity criteria, it involves the internal control that includes your positive and negative and blank value are within the prescribed limits. Cutoff of test run is calculated as per the kit insert or manufacturer. External control, whether it's a borderline positive or negative, are giving the valid result or not. Now, if the sample already or above the cutoff value, then it is reactive. But if your sample OD is below the cutoff, then it is non-reactive. There is a term gray zone samples. That means 10% of are in the gray zone. So your sample cutoff value is showing the 10% of the positive cutoff value. So we have to repeat it in duplicate. So if one or both are above the cutoff, then the sample is reactive. If both are below the cutoff, then the sample is non-reactive. And documentation is a very important part. So the date on which the test is done, the name of the kit used, the lot number, expiry date of the kit, standard value for the validity of the test, then signature of the lab technologist and the medical officer. Reactive units and the samples are marked red in the printout and working chart. Then troubleshooting. Then troubleshooting, what problems we will encounter, either it is a high background or there is no color development or low OD readings or poor reproducibility of the test. So one by one we will see what are the problems we are encountering and how we can resolve it. What are the reason behind it. This one is the first one. In this you will see that the background is high background color. So it can be happen because of the contaminated wash buffer or washer tubing. So what we have to do, We have to prepare the wash buffer freshly. We have to clean the tubing with the distilled water. Second reason can be incubation is for too long or at a high temperature. So we have to optimize the incubation time and the temperature. Then reuse of the disposable tips. Then we have to discard after use each and every tip. Improper washing leading to the residual conjugate. So we have to check the performance and the vacuum of the washer. Then colored substrate. So either there is a contamination with the metal ion or the conjugate. So the fresh substrate to be used. Then improper concentration of the stop solution. So we have to check the concentration of the stop solution and the quality of the distilled water. Next, there is no color development. So no color development plate. So reasons are forgot to add the sample conjugate or substrate. So we have to follow the SOP. Then added in the wrong sequence or short substrate incubation. So in all these we have to follow the SOP properly. If no color is in the positive control, then either it's a defective control or the wells or expired microplate. Inactive microplate, always cover the unused strip with the bag inside. So there is a desiccant bag inside. We have to cover the unused strip with it. Substrate contaminated with the stop solution, we have to prepare the fresh substrate. Next one is, if you see, the wells, different wells are getting colored. So this is the false positive result. These are lipemic or hemolyzed samples. So avoid use of the hemolyzed sample. Incubation at higher temperature. Take the temperature before the incubation. Improper washing, less volume of washing is used or less soak time, then wash the wells with adequate volume. Contamination of reagent. We have to strictly follow the test procedure as per the package or the manufacturer and check the equipment. Then air bubbles during reading. So we have to remove these air bubbles by gentle tapping. Next one, if you see, there is color in a one column. That means high color in one row or column. Second, in this picture, you will see there is a high color in a one row. So wash channel of washer is clogged. So we have to unclog with appropriate needle. Overflowing of well in one row or column. So we have to check the vacuum pressure of the equipment. Contamination from well to well. So check the wash performance of wash head. Then control out of validation criteria. So there is a cross contamination of the control. So we have to check the pipettes and we have to interchange the caps. So incorrect filter used, check the filter wavelength, incorrect temperature, timing and pipetting. So we have to follow the SOP properly. Expiry agent, always check with the kit before the expiry. We have to use that kit. Then improper reagent preparation, error in dilution, reagent not mixed. So check the procedure properly. If all this is happening, then we have to repeat the procedure. Thank you. Like, share, and subscribe the video.